Hello, guys, and welcome yet again to another episode of Therapy with Ndenya. We are on the third episode. Yay! And of course, I'm really appreciative for the support. I'm really appreciative for constantly liking and commenting on my videos, and also the subscriptions. I couldn't do this far without you guys. So, on our previous videos, we have talked about what counseling is and what it is not. We have also talked about ways in which you can identify the right fit for you in terms of a therapist. Today, I'd like us to talk about ways in which we can recognize some of these signs and symptoms that can make us understand, or rather give us a hint about maybe having a mental health problem. Okay, so join in and be with me till the end. I will really appreciate it. So, on the first point, we will go with recognizing common symptoms. When you think that maybe you have a mental health issue or something that is coming up mentally, there's some of the symptoms that you can check out. Okay, so if you recognize some of the common symptoms that are there, which are different diseases, which are different conditions, mental health conditions, you can be able to seek for medication earlier. You can be able to seek for interventions earlier. So let's start with number one, the emotional symptoms. If you in any way you are feeling like you have this persistent sadness or you are depressed in any way, that could be a sign of depression. That could be a sign of an upcoming mental health issue. Disclaimer, before we continue, I'd like us to realize that some of these symptoms have to be prolonged for a period of time so that you can be diagnosed to have that particular issue. So when you go to Google and you scroll and you see some of these symptoms and then you're like, yeah, I think I have anxiety, I think I have PTSD. No. Please, it's advisable that you go to a mental health practitioner who is going to help you identify some of these things and diagnose you with the conditions. Okay, it takes a huge criteria to finally diagnose someone with a particular mental health condition. So please do not self-diagnose. Okay, so like I was saying, there's persistent sadness and there's depression. When you're constantly sad, when you don't even understand or have a root of the reason why you're sad, it could be a reason to indicate that there is maybe a problem with your mental health. There may be a problem that is coming up. Number two is intense feelings of guilt or helplessness. You're just feeling worthless. Okay, those are some of the symptoms that will show you that there's something wrong somewhere. If you're feeling guilty, maybe because you did something, or if you did something, then of course you can feel guilty if it is not something you're used to or it goes against your values. But when you're constantly feeling guilty about even some things you didn't even do, or some things you don't understand happening in your life, then sometimes it could be a sign that shows that you have a mental health condition. We also have worthlessness. Feeling worthless, you feel like you have no value in this life. You're adding no value to anyone in this life or your own life. That is a sign and symptom that may show that you may be coming up with a mental health issue. Another one is extreme mood swings. You have extreme cases of having ups and downs that are misunderstood, or rather you do not understand them. Okay, you're in constant bouts of energy, then the next minute you're having very low depressions. You feel like life is meaningless. You feel like you can't even go on with the regular activities you're used to. Then that is something you should look out for. Another one is excessive anxiety, worry, or fear. You're anxious, constantly anxious about something of which you do not understand. Something is making you worried. Sometimes it's not even a worry that you can actually pinpoint. You're just worried. You just feel like there's just something that is not okay. Okay, and you're fearing. the fear of tomorrow, the fear of the future, the fear of the outcome of maybe something you had set out to do. You're constantly in worry. These are some of the emotional symptoms that could actually indicate that you're coming up with a mental health issue or you're suffering from one. So let's go to the behavioral symptoms. Behavioral symptoms, number one, we will start with withdrawal or isolation. You will start withdrawing from your family members, start withdrawing from friends, workmates. You will start even withdrawing from the activities you used to love. You have a particular hobby you used to love, you used to do, drawing, maybe watching, maybe going out with friends. You start isolating from your friends, start isolating the activities that you love to do. You're just not the same person you used to be. That is an emotional that is a behavioral symptom that something may be wrong somewhere. Another one is changes in eating and sleeping patterns. Are you eating too much, or you just lost your appetite, or you're sleeping too much, or you have insomnia? These are some of the symptoms, signs and symptoms that could actually indicate that there's something wrong somewhere, okay? That could actually indicate that there's a mental health issue somewhere, okay? Another one is increased use of substance. There's using drugs, not drugs really, because there's smoking and there's alcohol. You could be using them for recreation. But once the use of them becomes a constant habit, the use of them becomes a constant thing that you cannot live without. You cannot function without. Your work is affected by it. Your family is affected by it. You're no longer able to do anything without using that particular substance or drinking alcohol. Then that is something you should be looking out for. Because when you constantly do it, when it becomes a habit, it creates dependency. And once it gets to that point, you will not be able to do anything without using this particular drugs or this particular drink of choice. Sawa. Another one is difficulty functioning. You had bouts of energy, you were motivated, ulikuwa na morali ya kufanya kazi, but now all of a sudden things have changed. The work you used to love, you no longer love. You start being absent, you start going to work late, or most of the time, even when you go to work, you have no energy to do that particular work. When it comes to family, you used to enjoy spending time with your wife, your spouse, your girlfriend. You used to enjoy time with your kids. You used to enjoy time with your general family. But all of a sudden, you do not have any motivation, you do not have any energy to spend on them. Those are that is one of the symptoms that can show you that something is actually wrong somewhere, because it indicates that you need to isolate so that you can maybe regroup yourself. You understand? It shows that there's something wrong somewhere. Engaging in risky behavior or self-harm behavior. That one is where you get to a point that you're now self-harming yourself. Some people who self-harm usually cut themselves or burn themselves. I have seen someone who was burning themselves with cigarettes, because that pain a bit takes them back to reality. You understand? And I feel like that pain usually brings some solace to them. Okay, and if you start doing that, or reckless driving, you start driving recklessly, you no longer mind the speed limit, you just go overboard, or you just drive aimlessly. You understand? That is being reckless, and that is reckless behavior that is sometimes may cause death or harm to you, which will be for a very long time. And when it comes to risky behavior, that could also be sexual. You understand? You start engaging in risky sexual behaviors, sleeping around, being promiscuous, not even caring if the other person is sick or not, if they have any form of sexually transmitted infection or not. You just sleep with whoever, you just sleep with anyone who is willing to sleep with you. That is a sign that there's something very wrong somewhere that needs to be addressed as soon as possible. Those are the behavioral symptoms. Let's go to the cognitive symptoms. Cognitive symptoms are the thought patterns. Okay, how have your thoughts changed? How has the way you're thinking about something, your perspective of the world changed? You understand? Number one is difficulty concentrating. Maybe when you're at work, you find yourself zoning out, you find yourself losing concentration, especially when you're in meetings or talking to a colleague or even doing the task itself. It gets to a point that your concentration veers away and you forget whatever you were doing and totally get lost to another world. You get to start thinking about other things outside what you're supposed to be thinking of at that particular time, which also includes making decisions. Your decision making becomes problematic. Okay, you start making impulsive decisions, you start making reckless decisions, and you start forgetting. Yes, sometimes even remembering some very vital things in your life, or some things that are you used to remember all the time, they start becoming a problem. You start forgetting them one by one. You have a very short memory about some particular things. That is one of the symptoms, cognitive symptoms, that you should look out for. Another one is persistent negative thoughts or excessive worries. Negative thoughts, you start thinking negatively. When you are positive, when you looked forward to a positive life, or maybe you had a positive thought process, now everything has become negative. You become pessimistic. The person who looked forward to a very beautiful life, maybe making money for yourself, upgrading in your career, progressing from this position to the next, have these negative patterns where you'll start thinking of all the negative things happening in your life, and when you start inviting negativity in your life, that also affects very huge has a very huge impact in your life. You understand? Because positivity will always attract positivity. And once you start thinking negatively, it is always going to affect you and your life negatively. And excessive worries. You start worrying about everything. You understand? You start worrying about minor things or major things, or even things that you don't even need to be worried about. Things that are just happening in your life. So that excessive worrying and having negative thoughts is something you should actually look out for. Okay? Another one is unexplained anger or irritability. Have you ever found yourself in a position where you're just angry? If anyone asked you what you're really angry at, you wouldn't even understand. You wouldn't even explain what is really making you angry at that particular moment. And that is one thing you should actually look out for. Okay, if you feel like you're angry about something, or you're easily irritable and it is just out of nowhere, because there's some people who have had anger issues from a while back, maybe from childhood, but now it is just out of nowhere. You're unable to regulate your emotions, you're unable to regulate your anger, you're easily irritable, just something kidogo, you snap out of nowhere. That is something to look out for. Maybe there's some things that you're bottling up inside you that are causing you to get to that particular point. And another one is hallucinations, or you're hearing voices. Hallucinations is where you're seated and then you start maybe start seeing things that are unrealistic, things that are maybe non-existent, that are not existing in that particular time. When you think about it, that may be a cause of something. You understand? Sometimes we can say it is because of some drug and substance use, but what if you don't actually use the drugs, or you don't drink alcohol? Then all of a sudden you start seeing these figures in front of you. You start hallucinating and building castles in the air. You understand? And another thing is hearing voices. You just hear voices in your head talking. You're hearing them discussing, or maybe they're constantly poking you and urging you to do or make decisions that you really don't understand, or maybe you're not ready for them. Okay, so those are the cognitive symptoms that you can actually look out for. And last but not least, we have the physical symptoms. Okay, so if you feel like the emotional symptoms, the behavioral symptoms, and the cognitive symptoms may be lacking, actually, or maybe they are not tangible enough to help you indicate or rather recognize if you have a problem, you can actually look out for the physical conditions, okay, rather symptoms. Number one is unexplained aches and pains. We have heard of psychosomatic problems. You have heard of psychosomatic diseases. Psychosomatic diseases are whereby you have this condition or pain in your body where you cannot really understand, or where you cannot even trace the pathological reason, the pathological cause of it. Okay, you will go to the hospital, get treated over and over again, get medicated, given different prescriptions, but at the end of the day, that particular ache, that particular pain does not go away. Some pains are usually caused by stress, some pains are usually caused by anxiety, some are usually caused by different conditions, mental health conditions that one may have. So look out for those aches and pains that are unexplainable, whereby you will take medication, that is painkillers, and you will go look for a doctor and get prescribed, or maybe the doctor does not get to diagnose anything on you, and you keep wondering, where is this coming from? Maybe it could be because you're suffering from a mental health issue, or something is coming up that you may not understand. So look out for that. Another one is fatigue. Fatigue is you getting tired. You just overly tired and you don't even understand. You wake up in the morning and you just feel tired. By midday, you feel like you have had an entire acre of land to toil. You understand? And it gets to a point that it also affects your energy level. You lack energy to do anything, lack energy to do your work, lack energy to even have any hobbies, lack energy to even go to school, that is if you're a school going student. And there's a lot of things that it is going to affect, because you can't do work when you're tired. True or false? You'll find it so hard to do work when you're tired. You will constantly be feeling tired, and your body will want rest, of course. And your mind too, it will want rest. So that fatigue, look out for it. If you feel like you're constantly tired, you're constantly feeling low in energy, then that could be a symptom that something is wrong somewhere. Okay? And another one is changes in appetite or weight. So like I was saying, if you feel like you lack appetite, or maybe you have an increased appetite, it could be an indication that there's something wrong somewhere. Some people will eat less when they are stressed. Some will actually binge eat when they are stressed. So look out for those symptoms that could show you maybe that your appetite has changed in a way, in an abnormal way, which is going to indicate that there's something wrong somewhere. If you're eating too much and you used to eat just the normal portions, then look out for that. If you lack appetite and you used to have good appetite or normal appetite, then look out for that. In the weight, when you lose weight, all of a sudden you see in a span of maybe a month or 3 months you have lost a lot of weight, then look out for it. Not when you may be exercising. If you have been doing exercises or intermittent fasting, then that is understandable. But just out of nowhere you're losing weight or you're gaining weight, that is something to look out for. Because yes, some people actually do gain weight from stress. They actually binge eat, or maybe the stress hormones make them grow, make them unweight. So gain weight, that is. So make sure you look out for those symptoms. If you're feeling that you have lost your appetite, or you're losing your weight, or you have added your appetite, or you have added some weight, okay, look out for that. And last but not least is sleeping disturbances. Are you sleeping too much? Are you sleeping less? Do you have insomnia or hypersomnia? Check out for those symptoms. You know, someone may the normal hours, of course, there's the normal hours you can be sleeping that are usually normal, even recommended for. But when you now find it difficult to wake up in the morning, or maybe you find it difficult going to bed because you have insomnia, and it was not there before. This is an abnormal change that just spurred out of nowhere, and that has started affecting your livelihood, affected your everyday functionality. Then that is something to look out for. Go check out for those symptoms. That is the emotional, the behavioral, the cognitive, and the physical symptoms, so that you can be able to intervene earlier in advance before it gets to a point that you will now need maybe hospitalization or constant medical care. And let's go to the next point, which is reflect on duration and the impact it has on your life. The duration, like I said before, some of these conditions are usually diagnosed after a period of time. The criteria will usually say after a period of time, maybe if the symptoms are constantly appearing and you can constantly recognize them over that certain period of time, then you could be diagnosed with that particular condition. So check out. If it is just been once and then the following week, that could be just minor conditions that could easily be intervened. But if you have this constant symptoms over and over again every day for a period of time, and it has actually impacted your everyday functionality, it has changed the way you work, it has changed the way you think, the way you perceive life, and everything about your life has just taken a 360 about turn, then you should definitely go and check out about that. Recognize that that could be an indication that you have a mental health issue. And another one is use screening tools. So many psychologists have come up with different screening tools that are able to help you identify things like depression, things like anxiety. So take regular screening tools that are going to help you identify some of these problems that you may have. Okay, if you use those screening tools over a period of time and you come to realize that the checklist, after we may check the first one, we may check the second one, the third one, and you finally realize that I could actually be suffering from PTSD. I could actually be suffering from depression. I could actually have borderline personality disorder. When you use those screening tools and you find that the results come up positive or negative, that could show that you really need to go see a psychologist or psychiatrist who is going to help you solve some of these issues. Okay, and on to the next, which is actually assessing specific conditions. Specific conditions have specific symptoms. Okay, when we were talking about the cognitive, the behavioral, the emotional, the physical symptoms, some of them are actually unique to a particular condition. So assess the specific conditions to understand what it is exactly you have. And below I am going to indicate some of the conditions and their symptoms so that you can be able to identify if maybe that could be something that you could actually be suffering from. Let's start with depression. So depression has a few symptoms. We will start with number one, persistent sadness. You're constantly sad. You're constantly melancholic. You're just thinking of all the bad things that have happened to you, or the things that might happen to you because of something. Sometimes the sadness could be because of loss of a family member, loss of property, loss of a job or something. But if you're constantly and persistently sad out of nowhere, then that is something to look out for. That could be an indication that you are depressed. Number two is lack of interest. You totally lack interest in anything. The work you used to love, you no longer like it. The activities, the things you used to love doing, you no longer like them. The friends, the family members you actually enjoyed the company of, now you do not actually like them. Okay, and it is something you should look out for, because we as humans, we are not islands. Okay, we need other people to survive. We need other people to get some things, or even the social and the moral support. But if now you feel lack of interest in even interacting with them, then check out for that. If you lack interest in even the hobbies that you used to love, check out for that. Okay, another one is changes in appetite. Like I said, you have to look out for the weight, the weight gain or the weight loss, or the increase in appetite or the decrease of it. That could be an indication that you're depressed. Okay, if you're constantly eating, especially junk food, you just want to eat junk food over and over again, that could actually show that you are depressed. Okay, because that food, that junk food that you're eating, could be a way for your escape. It could be a way to console yourself, your inner child, and that is an indication of depression. And last but not least is thoughts of suicide. If you just feel like you're just thinking about death, and sometimes even wishing that maybe you could rest, wishing that maybe you could end your life and maybe get a solution to the problem you're having at that moment, yes, that could be an indication that you are depressed. So check out for it. Check out for maybe sometimes if you feel like committing suicide or you have those ideations, check out for that. That could be an indication that you are depressed. Okay, and another one, let's go to anxiety. These are the symptoms that could actually indicate you have anxiety. Number one is excessive worry. Are you in constant worry? Are you constantly fearing something? Are you constantly anxious about something? Yes, that is an indication that maybe you have anxiety. Okay, number two is restlessness and difficulty concentrating. Yes, you are restless at work, you are restless at school, even in your house, you are restless. It could be a different condition, which is ADHD, where someone is constantly hyper and they just want to be doing something at all the time. But when it just appears out of nowhere, yes, that could be an indication that you actually have anxiety. Another one is fatigue. Yes, when you feel like you have fatigue, when you feel like you're constantly tired, you constantly have low energies, you have no energy to do absolutely anything, sometimes even getting out of bed, that could be an indication that you have anxiety. Sometimes anxiety will just push you to just lay down. You do not feel like doing anything because you have constant worries, remember. So you worried that maybe whatever you're going to do is not good enough. You worried that maybe the goals that you had are not good enough. You understand? So you're constantly restless, you're constantly fatigued. Yani umechoka tu. Okay, and another one is the physical one. And now a physical indication that you may have anxiety is racing heart. You know, you have those palpitations, yani moyo wako inaanza tu kudunda haraka haraka. Out of nowhere you just feel like maybe like when they say you have a panic attack. Yeah, your heart is just beating too fast and you can't really understand why it is doing so. You understand? That could be a physical indication that you have anxiety. Also sweating. Yes, sweating, maybe you have had you have gone up 10 floors with the stairs, up with a sweat, of course. Maybe umekimbia marathon, there you will sweat. But when you start having these sweating bouts out of nowhere, unaanza tu kusweat, you don't even understand where it's coming from. Yes, that could be an indication that you have anxiety. Okay, another one is bipolar. Yes, bipolar is usually characterized by extreme mood swings. That is episodes of highs and episodes of lows, which is the mania and depression. So when you feel like you're constantly high and then just a few minutes later you're very low, like you're very depressed, that could be an indication that you have bipolar. Bipolar is like the word bi is two, so maybe it may indicate that you have bipolar disorder. So go check out Renee for it and go get a therapist who's going to help you diagnose you and help you with medication that is going to help you come out of it. And last but not least is PTSD, that is post-traumatic stress disorder. These are some of the symptoms that are characterize PTSD. So, number one is flashbacks. Do you have constant flashbacks of that particular event? Are you constantly just thinking about it? umekaa tu doing your own work, umekaa tu doing your homework, ama maybe you have an assignment, a project in school, and you just have these flashbacks out of nowhere that are constant. Now they keep coming back over and over again. Yes, that could be an indication that you have PTSD. Another one is nightmares. Umelala usiku, but you're completely restless. You start dreaming of that traumatic event that happened. You start recollecting all the things that happened in that particular time. Yes, that could be an indication that you have PTSD. Another one is severe anxiety. I don't know if you have ever met someone with PTSD, most especially the soldiers when you wametoka in war, like our KDF when you walipelekwa Somalia. Some of them, if you meet with them and actually interact with them, some of them have severe anxiety. They're always shaking. They're always waiting for anything to happen anytime. Yes, that is an indication that you're actually suffering from PTSD. And last but not least, we have uncontrollable thoughts. You cannot control your thoughts anymore. You just constantly think of the traumatic event that happened, and of course it's going to affect your functionality. It is going to affect your everyday thought, your everyday living. Because if you have these uncontrollable thoughts that keep taking you back to that event, they keep drawing you back to that particular event that is now affecting your everyday life, of course it's going to disrupt everything around you. Okay, so look out for those symptoms. Look out for those specific conditions. Maybe they could be coming up, or maybe you could be suffering from them at that particular moment, and it is very advisable that you seek medical attention as soon as possible. Okay, so let's go to the next point, which is consider life changes or stressors. Okay, considering life changes. Has your life changed? The way you used to view life, has it changed? Your behavior, has it changed? Are you constantly stressed? Are things just the stress is just everywhere around you? Look out for that. Okay, because those are some of the things that could trigger a mental health condition in you. Okay, maybe you have moved to another place. That is something that can cause anxiety. Maybe you have constant stress, constant anger, depression. Yes, those are some of the things that could indicate that you have mental health issues, or they could actually trigger the mental health issue. Another one is listen to feedback from others. Some of us have had our parents, our friends, our siblings, or even colleagues tell us, "Ai, na umebadilika." That one word, it's either umebadilika for the good and umebadilika for the worst. Okay, and if you feel like, yeah, like you have changed in your behavior, maybe a particular time you were thinking differently, you were behaving differently, but now things have changed, that is something to look out for. You may not know it. There is that part called the blind self. You may not know it yourself, but the other people have actually recognized it. Actually, other people have actually identified it. So check out for feedbacks. If people actually tell you that you're now reckless, or maybe you have changed, you're no longer motivated, you're no longer fun like you used to be, check out for that. That could be an indication that there's something wrong somewhere. Another one is evaluate your coping mechanisms. How do you cope? How do you cope with your stress? How do you cope with your triggers? How do you cope with your anger? If you realize that you're actually using substance and alcohol for an escape, that is something you should look out for. You understand? Are your coping mechanisms reckless driving? That is something you should look out for. Or is it the healthy one where you go to the gym, exercise, go out in nature? Check out for that too. You understand? Evaluating your coping mechanisms will help you understand if you have a mental health issue or you do not. Sawa. Another one is role of genetics and family history. You have heard most of these conditions are actually genetic. They actually pass through generations. So if your brother, if your father, if your uncle may have had anxiety, there is a very big possibility that you may also suffer from anxiety. If they have borderline personality disorder, there's a very big chance that you could actually go through the borderline personality disorder. So if you also have a family history of alcoholism, check out for it. You could actually be on your way to alcoholism, or you could actually be at a risk of getting alcohol dependency. So check out the roles, the genetics, and the family history. Another one is monitor behavioral changes. Monitor the way you behave, and even check out from before, how you were behaving before to now. Before even the family realizes it, before even your friends give you feedback, sometimes you can understand, or rather recognize, some of these patterns. You used to sleep for like 8 hours, but all of a sudden you just sleep for 3 hours, 4 hours, or you hardly sleep. You hardly get in even the sleep because you're in constant worry. You have changed your eating habits. You used to love eating, but now all of a sudden your appetite is gone, or all of a sudden you're overeating. You're just constantly eating. That is something to look out for. Those behavioral changes could actually indicate that there's a mental health condition you could be suffering from. And another thing you could help yourself with is educating yourself about mental health conditions. Learn about them. Learn about PTSD. Learn about ADHD. Also learn about depression and all those mental health conditions. Maybe through learning about them, you'll also be able to recognize some of these patterns that you may be developing, or you may have, that could indicate that you have a mental health condition. And last but not least, regular self-assessment. Assess yourself regularly. Make sure that you're okay. Make sure that your mental health condition is fine. And even check the regular assessment will actually show you the negative change patterns that have actually been coming up. It will actually show you that you may have had a change in maybe your cognitive patterns, your physical patterns. It could really show you exactly what you're looking for. Sawa. And above all, please do not self-medicate. Do not self-diagnose. If you find that any of these conditions you may be having, maybe you feel like you may be suffering from one of them, then it is good to seek a therapist or a psychiatrist who is going to help you diagnose, help you prescribe, and help with prescriptions that are going to help you with those particular conditions. Sawa. And above all, please take care of your mental health. Remember, your mental health is your priority. Okay, so I really appreciate for those who have come this far. Thank you for watching. Don't forget to keep subscribing and liking, and comment below whatever topic you'd like us to discuss next. Thank you so much. I have been your host, Nenya, and I will see you on the next video. Bye.